Finally, let's discuss the heart's normal frontal axis and how to see it on ECG to diagnose abnormality. We have seen how frontal axis of heart is covered by limb ECG leads from 0 degrees to 180 degrees to -90 and back to 0. The normal axis of heart vector or current is between -30 degrees to 0 degrees. We said during QRS depolarization how the main depolarizing wave moves downwards and leftwards due to left ventricular mass size. In order to see this axis through QRS, we take two leads only which are present at right angle to each other. The lead 1 is horizontal lead at 0 degrees while lead AVF is moving downwards at 90 degrees. So how would R wave register on these two leads in normal axis? The red arrow indicates the depolarization wave direction. In normal case, it can be anywhere between -30 degrees to +90 degrees. This would be within the plane range of both lead 1 and AVF, thus generating a positive deflection in both leads. But if the red arrow moves leftwards and upwards beyond -30 degrees, it would still be in the range of lead 1, thus lead 1 would have positive deflection. But for AVF, the red arrow is in opposite direction moving away, so negative deflection on AVF. This is diagnosed as left axis deviation, highlighted in orange, between -30 to -90 degrees. Let's see this on a 12 lead ECG. In this ECG, you can see positive going lead 1, but in lead AVF, the QRS complex is downgoing. So, a left axis deviation. In normal ECG, both the leads will have upgoing deflection. Left axis deviation can be normal variant or due to any disease causing left ventricular hypertrophy or displacement such as mediastinal shifts. Now we have discussed this earlier that ECG leads register the left ventricular depolarization above right ventricular vector currents because of huge size and wave amplitude generated in left ventricle compared to right ventricle. But what if any disease leads to right ventricular enlargement? In such instances, the dominant vector would be right ventricle depolarization wave, right? The depolarization wave would still be in range of AVF, generating positive deflection, but markedly away and opposing the left-sided leads, thus a negative deflection in lead 1, highlighting right axis in blue between +90 degrees to +180 degrees. So let's see axis deviation on this ECG, taking the two leads, lead 1 and lead AVF. There is negative deflection on lead 1, meaning vector is opposing direction of lead 1, and there is positive deflection on AVF. So a right axis deviation. So as said before, any condition such as COPD, pulmonary hypertension causing right ventricular hypertrophy would cause a right axis deviation. So in this way, calculating the axis deviation on ECG helps in giving vital information to reach a diagnosis.